The first of these is by Dr. Douglas Diekema, who is a professor of pediatrics at the University of Washington School of Medicine. And he's also very involved in ethics or bioethics. And I came across his writings because he's written extensively in this area, especially several papers related to immunization and various approaches, some of which we've heard about today. And he's also co-authored some of these with Doug Opel, who I had an opportunity to meet a few years ago, given that the proximity of our two locations, we don't get together nearly enough. And he's also been working in emergency room settings. So he's an attending physician in the emergency department at Seattle Children's Hospital and serves as a director of education at a Center for Bioethics at the Seattle Children's Research Institute. He's going to be speaking to us this morning about what can we do about parental vaccine refusal. So welcome. Thank you very much for making the trip.
Thank you. There we go. All right. It's a pleasure to be here, and good morning, everybody. My actual clinical practice is in the emergency department, so I tend to deal with kids who are unvaccinated and have stepped on nails and developed pertussis and lots of those sorts of things. And I have made refusal of vaccination sort of one of my academic interests, with my overarching interest in bioethics being the discretion that parents should have to make decisions for their children and when the state should actually step in and intervene. So what I wanted to do this morning, I'm going to present sort of a backdrop first, which will build a little bit on what the three speakers who preceded me did, and then focus on some strategies that I think we should consider for combating vaccine hesitancy and refusal. And you get to see one more picture of Edward Jenner vaccinating 8-year-old James Phipps. You'll notice that this one is in a nice-looking living room, and James actually looks cooperative in contrast to the one you saw just before the break, where it looked like he was in the garden and trying desperately to get away with. The person I assume holding him down was his father. James was actually the gardener's child. It raises some issues about justice and research ethics, which we won't get into this morning. But fortunately for James, it actually worked. Many of you are familiar with this data. This is just to remind us that despite what some people would like other people to believe, as our president in the United States would call it fake news, although everything he calls fake news is real news, and everything he calls real news is fake news. But in this case, this is the real news, and that is that we know that vaccinations work, and they have a profound impact on public health, and in particular, children. I think other than clean water, it's difficult to come up with any intervention we've ever created that has had such a dramatic impact on children. And I personally, the data is one thing, and I'm going to talk about data and its impact on changing people's minds in a little bit. But what really makes this come alive for people who are my age in particular is having lived through a couple of vaccines. And the impact of Haemophilus influenza, the Hib vaccine, and the pneumococcal vaccine for people like me who started their careers seeing kids with H-flu or pneumococcal meningitis, H-flu epiglottitis, seeing these kids die, seeing these kids lose their hearing, end up with brain damage. On some, depending on where you were practicing, it could be as frequently as weekly. And, I was evaluating kids like this on a weekly basis and probably caring for somebody with one of those diseases at least monthly. And it has been 25 years, I think, since I have last seen a case of H-flu, which is remarkable to me. We hated that disease when I was a resident. It changed the way we thought about kids with fevers. The residents I work with today, fever is just sort of like, another kid with fever. But every child with fever we got asked to come down to see in the emergency room was a potential child with H-flu meningitis or sepsis or something else. and could turn and die on you in the next 3 hours. And it was the impact of vaccines, on my life and sort of the stories I can tell is dramatic, because those were some of the most memorable kids I took care of 30 years ago or 25 years ago. And it's just doesn't happen anymore. And chickenpox has sort of become the same way. I never actually thought I'd be the person in the ER who gets dragged into a room because nobody knows what chickenpox looks like. Okay. That used to be a pretty basic part of what we did. But again, it's pretty remarkable. So a couple of points to begin with. Historically, there have always been people who have opposed vaccination. And I think this is something that we don't always fully recognize, that this is not a new issue. It existed in the days of smallpox. And what's really interesting when you look back at the history of smallpox is the lengths to which some parents and people went to avoid vaccination. They were just as extreme as what, and maybe more extreme. They were actually, in some cases, assaulting public health officers 200 years ago. But also, what's even more interesting is when you look at the reasons those parents had for opposing vaccines, they are identical to what parents say today, 200 years later. Maybe today's parents have gotten a little more sophisticated in the way they fill out those arguments, but they're all the same. I'll show you a list in a minute of what parents say the reasons are for not wanting to vaccinate their kids. And that's the same list we had 200 years ago from parents who didn't want smallpox vaccine. Herd immunity for most of the vaccines requires 90 to 95% of the population to be vaccinated against that particular antigen. And if you don't achieve that, the sort of public health ethics issue you're faced with is either coming up with a non-coercive way to get those levels up to the point where the community is protected, or relying on more coercive methods. And the comparison between the approach and the US approach is kind of an interesting one. Neither one of us uses a truly coercive approach. Very few countries do. But ours is considerably more, considerably approaches that boundary of coercion more closely than the Canadian approach does. So the first big point I want to make is that under-vaccination can't easily be or simply characterized. And I'm going to show you why here quickly. And a couple of our speakers earlier today summarized some of this for you. And it's really the big picture I want you to get here, not the details. But what you can see, what we see in the United States most commonly is there's some pretty dramatic variation from state to state, and some of that is explainable by state policies and laws, and some of it's explainable maybe by the social differences between regions in our country. But you can see there's a lot of difference in color there, and the colors are sort of in the wrong direction, actually, in our neck of the woods in the Northwest, with Washington, Oregon, and Idaho being kind of national leaders in something you don't want to be a national leader in, which is having under-vaccinated kids. But it gets more interesting, and you saw a slide similar to this morning when you look at the county level, because it's one thing to look at Washington State and say, our under-vaccination rate is X. But what's important to recognize is that it's not the whole state, it's regions in the state. And this has important implications for disease spread. Because most infectious diseases we vaccinate against are not going to spread very widely in Yakima County. That Yakima County Public Health Department, if they get a case of measles, will probably be able to contain that fairly rapidly. Because their vaccination rate is quite outstanding. On the other hand, if you go to the wild, wild west, which is actually the east part of our state, I don't know what the hell is happening up there, but Ferry County has like a 30% unimmunized rate in their school kids. Now, the only thing that would save us there if measles broke out in that county is there's probably only 4 kids in that county. But there's something going on up there, and it's probably a kind of an anti-government sort of thing. That's also where a lot of the marijuana is illicitly grown in the state, and there are other things going on up there that is sort of a hands-off, don't tell me what to do kind of thing going on. But it's important to recognize these regional differences. And then when you look at school districts, it gets even more interesting, because this is where outbreaks are going to occur, right? You put a case of measles in a school with a low immunization rate, and you've got a problem. So this is my school district, which is closed today so they can, I don't know, do what related to coronavirus, because they haven't had a case of coronavirus in the school district, but they sent the kids home anyway. You can see our vaccination rate. So my kids went to Kenmore Elementary, and the MMR vaccine exemption rate is 1.6%. So that's pretty good. That means, as you saw this morning, that measles is not going to get very far, even if a kid shows up at school with measles. It's going to do a little better at Kenmore Middle School and Arrowhead. But then we go to, but measles doesn't stand a chance in Yakima County. So I showed you Yakima County, and this district, look at the remarkable job they've done there. And it's not just that they've done the job, it's probably the demographics. Yakima County is where a significant percentage of the population is made up of migrant farm workers who actually have come from places where they consider vaccine to be a benefit because it maybe was hard to get where they were, and they have seen some of these diseases and they know they want to prevent them. And so they don't have a lot of trouble getting people to comply in Yakima County. But when we move over to Vashon Island, which has a reputation, you can see we have schools there who have exemption rates of 30%, 20%, and even the better ones. Fortunately, the special education school is 0, and it should be, because those are the most vulnerable kids, many of them. But everybody else is actually above the herd immunity rate for measles. So even in the 6% school, you're going to see measles spread. And in that 30% school, it's going to wipe it out. One case in a classroom there is just going to spread like wildfire. So the local level is really an important piece of this whole puzzle. You can't just say, oh, Washington State has a problem. It's not that Washington State has a problem. It's that schools, specific schools in Washington State, have a problem. And every state looks like this. There was the big measles outbreak we had, you heard about Clark counties, but the one that got all the media attention was the one that started at Disneyland in California. And there is no better place to start a measles outbreak than Disneyland. And I was at Disneyland probably when patient 0 was there, because it was about 2 weeks before the outbreaks got reported. And I was there, it was Christmas time, and I was there reluctantly as a captive of my family. I hate Disneyland at holiday time because it's like you can't even get to the rides because the crowds are so bad. And so I'm walking through, not really walking through Disneyland, I'm kind of doing this through Disneyland with my wife, and a woman looks at me and then proceeds to cough in my face. And I kid you not, I turned to my wife and I said, this would be an awesome place to spread measles. That may have been patient 0 in that outbreak. But the other piece of what happened there was that Disneyland sits right near a part of California that has really a bunch of parents who really don't want to vaccinate their kids. So the school districts there have high exemption rates. And many, if not most of the cases we actually saw that resulted from the Disneyland outbreak occurred in those adjacent counties that we know are a setup for this particular problem. Now you saw a slide similar to this earlier, but what I wanted to point out here is that we always talk about exemption rate, but I want you to notice the green line, which is actually the highest line for the non-immunized kids, and that's the out of compliance line. And this is the other piece that makes it really difficult to sort of get a complete handle on what your vaccination status is in a community, because there are a substantial number or percentage of kids that don't have an exemption but aren't vaccinated. They're out of compliance and they're going to school, either because the school's not tracking it or they're not enforcing it or something is not happening. So that out-of-compliance rate has to be factored in. And then this is just to show you that it depends on what antigen you're talking about too. This story is not the same for every vaccine. Some are more problematic than others. So as we approach families, the first thing I think that's important to do, whether we're doing public messaging, social media, or actually interacting with families at an individual level, is first seek to understand where they're coming from. And it's really important to recognize that these are not anti-vaxxers, and they're not all cut out of the same cloth. Every one of these families is a little bit different. And the way I approach it as a clinician is, I need to diagnose what the problem is in order to come up with the appropriate solution for this family. And if you don't understand what their opposition to vaccination or their hesitancy about vaccination is, you'll probably be just shooting in the dark and missing the mark. And because we know there's a lot of variability here. A fair percentage of parents have refused at least one vaccine in the United States anyway, and I would assume the data here is similar. But you can see the vaccine makes a difference. We have more trouble with HPV than we do with other vaccines. And part of that is sort of this notion that it enhances or increases promiscuity, which it really doesn't, but that doesn't change some people's minds. But you can see there's variation there. When you talk to families about why, they don't all have all of these reasons. And again, these are reasons that people have given for 200 years. Some families, it's just too much. They've got this brand new baby, and now you want to turn her into a pincushion, and they're not very excited about that. And that's a really different problem than somebody who says, I'm worried about the ingredients in vaccines, or I think one vaccine or all vaccines are going to cause autism. If the only objection of a parent is, I'm worried that the measles vaccine will cause autism, your first priority is get the kid vaccinated for everything else, and then work on the autism measles sort of problem. But don't just sort of assume that because they're opposed to one, they're not open to the others. There are people that believe, and I've encountered these in my ER, that believe vaccines actually cause disease. I had a mom tell me that her child got pertussis because we vaccinate against pertussis, and she was convinced that's why. And increasingly, because of the success of vaccination, we have eliminated diseases like polio, and we have made very rare diseases like even chickenpox now, but certainly H. flu and pneumococcal disease. Parents don't know what these are anymore, and they're not scared of them because they've never seen them. They don't know anybody who's had them. And so it allows them to get a little comfortable with the fact that, well, why am I vaccinating against something that I've never heard of or doesn't seem to exist? We have these contributors, parental beliefs, which I just talked about, these unsupported links that appear in the literature, the lost memory of vaccine-preventable infectious disease, and we know that humans are terrible at risk assessment, and sometimes the way we frame things for families can help with that. But social media and some sort of loudmouth celebrities have not helped the issue either. People tend to listen to people they trust, and if they're particularly fond of one celebrity or they're particularly fond of one social media site or they have a friend who likes it, that's where they're going to get their information. So about 90% of parents feel vaccines are a good way to protect their children. That is actually fairly good news. And 88% generally follow their physician's recommendations. So the lesson here is having a good, trusting relationship with your provider, with a provider, is the best way to get kids immunized and vaccinated. That doesn't change the fact that a lot of these parents, including the ones that are willing to vaccinate their kids, are still worried about them. They still need some reassurance. But just because they're vaccinating their kids doesn't necessarily mean that some of these concerns don't exist. And so We also have, the other problem we have that isn't fully addressed by school requirements is that parents are delaying vaccines now. This is becoming very common in the United States. They want alternate schedules. And the two obvious problems there are that, first of all, you're not protecting the most vulnerable patients, who are the young ones, when you do that, and it's important for parents to recognize that. But the other problem, obviously, is that even if, like the data I showed you, you've got pretty decent data of kids going into kindergarten, it doesn't mean you had decent immunization data on 4-year-olds, because a lot of what's happening there is parents are sort of getting it all shoved in just before school so they can have their kid attend school in the United States, rather than actually getting them vaccinated against pertussis, for example, at 2 months, 4 months, and 6 months of age, which is when you really want it. Other than the public health issue, I don't really care if a kid gets pertussis at 4, but I do if they're 2 months old, because those are the ones that end up in my intensive care unit on ventilators and occasionally die. So unfortunately, the data we often collect is not really capturing the full problem we might have. Now, my colleague Doug Opel has put this slide together, which I find very helpful, because it sort of helps you understand this spectrum. About 70% of the population is what he refers to as vaccine acceptors. They have no problem with vaccines. A few of them may have a few concerns, but they go into the office or into the school totally intending to vaccinate their kid. It doesn't require a lot of time. They may have a question or two, but they're going to let it happen. And then on the other side, you've got the truly anti-vaccine groups, people who belong to those groups and subscribe to their beliefs and so on. And fortunately, it's a pretty small percentage of the population. But these are people who there is nothing you can say that will change their minds. And in general, if their child gets Haemophilus influenza B meningitis, it still won't change their mind. These are people who have a strongly held belief. And what I tell providers is, if you know you're dealing with this family, and again, my colleague, Doug Opel, has actually developed a screening tool for this. But my advice is, if you know you're dealing with something like this, just save your breath and your time, because you're not going to convince them. And they're probably not interested in hearing it, and they probably don't have any questions for you. This is the group we want to work with. It's those who have concerns. They're unsure about whether they should vaccinate or delay or have some other strategy. But the opening here is most of these families get advice from somebody they trust, and that's usually their provider. And so there is an opportunity here to change some minds. And we'll talk about some strategies for doing that. So what are some strategies? So the easy ones, in my mind, they're actually not so easy, but the obvious ones, the first one is, let's remove the obstacles to vaccination. My understanding, excuse me, is you've probably done that better in Canada than we have in the United States, because my understanding is that you offer vaccination in the schools. And that decreases the hassle of getting vaccinations. One of the things we've learned in the States is, I showed you those non-compliant kids. They're often not people who have concerns about vaccination. It's just they can't take time off work to get their kid to the doctor, or they don't have the copay for the vaccinations or the bus fare, and so they don't do it. They follow the path of least resistance. So step number one is, let's reduce those obstacles. This vaccination should not cost anybody a cent. It does in my country. We have programs that pay most of the cost for most people, but it doesn't cover it completely. It shouldn't cost anybody anything. If it's a public health issue as much as a personal health issue. Number two, I'm not going to talk a lot about this because Dr. Guichon gave you a great talk on this already, but rapidly and forcefully refuting unsubstantiated claims about vaccination is very important, and I think we're only just starting to get reasonably good at this. But this is a game we've been beat at by the anti-vax crowd, where they have been very effective using messages that we should be combating. And those messengers usually use fear, which is a very powerful motivator. in terms of getting people to act, or in this case, not act by not vaccinating their kids. And we need to be addressing that. The third one is to strengthen and enforce school vaccine requirements. Now, you all don't have school vaccine requirements, and I'm going to talk about that a little bit. But in the states, we have really quite substantial variation from state to state in terms of how easy it is to get an exemption from vaccinations, in terms of what excuses fly. So, we have what are known as, everybody has a medical exemption, and we know that fewer than 1%, well below 1% of the population actually legitimately can claim a medical exemption. But we also have religious exemptions and philosophical exemptions, which, quite frankly, in practice, are the same thing. Because the state, at least in the United States, constitutionally, the state cannot put themselves in a position to decide whether your belief is a religious one or not. So all you need to do is flip from saying, I have a philosophical objection to a religious one, and you really can't be challenged in the United States. Because who am I to say you don't go to a church of one? And so you're stuck. We do know that easy exemptions, those that are really easy to obtain, result in lower vaccination rates. So more people ask for exemptions, and high rates of exemption are associated with disease outbreaks. So, one of the lessons there is we should probably make them a little harder to get. And you also heard about what Ontario is doing there with you, right? You almost certainly have higher rates in Ontario, despite the fact that people say they hate the videos and they don't like them and they'd rather do them at home. The hassle of doing them gets kids vaccinated. What the data is not going to reflect is the number of parents who look at what they have to do to get the exemption and just decide to vaccinate their kid. Because you can bet that probably is where most of the added push is coming to get kids vaccinated. It's actually the parents who just look and say, I'm not going to do that. I'm going to just take my kid into the ER or the doctor, or have it done at school. There's also wide variability between and within with regard to what vaccinations are required and who qualifies and all that kind of stuff. So this is not fully dated, a little more dated because we're seeing changes in our state laws. But suffice it to say that we now have 5 states that only allow a medical exemption. Mississippi and West Virginia, who trail the country in every health indicator, lead the country in 1. And that is the number of kids vaccinated. And it's because for years, for actually decades, they have only allowed a medical exemption. And they have 99% vaccination rates among their school kids. And that's why. Now, recently, Maine and California have been added to the ranks there, although Maine is currently got legislation in front of their legislature to roll that back again, and this is sort of what we're seeing in the states with the anti-vax influence countering the sort of medical and health and public health influence in the legislatures. But you can see there's a lot of variation there. This also, the details here are not important because it changes every 6 months, but it's just to show you that as we have states that are introducing bills to try to make it harder to get exemptions to vaccination, but we have just as many states, and they're often the same states, with bills in front of the legislature to make it easier to get exemptions. And so this is basically a battle that's going on in state legislatures across our country. Technically, as I mentioned, even a law that says you can't go to school without vaccination is not truly coercive. So ethicists think about this, because parents always have a choice. Nobody in our country ever makes a child get vaccinated. What we simply say is you can't go to school if you don't either have an exemption or get vaccinated, and you'll have to use other options. Homeschool your kids, find a, in some states, private schools don't have to abide by these state vaccination laws, so they can send their kids to a private school. It's also part of the reason you see private schools with really high exemption rates in a lot of places. And then I mentioned the variability and how hard it is to get a vaccine exemption. So in a lot of states, the easy states, they just need a signature. Sign a piece of paper, they download off the internet, turn it into the school, you got your exemption. And then there are other states that make it harder. Some people require an in-person educational visit with a healthcare provider. Washington State now is one of those. That's not quite as onerous as what Ontario is doing in terms of making people watch. I guess if you want every vaccine exemption, you got to watch hours of videos. In-person educational visits with a health department official, and online training where you print off a certificate, which is a little easier than an in-person visit. Washington State made a change to their law a few years back where we went from a philosophical exemption that only required a parental signature to one that now requires a healthcare provider signature saying that you have counseled the family. That requires at least going into the office to have a visit. And we were surprised that actually did make a difference. What we saw was a drop in the number of kindergartners who had exemptions after that. And all we had really done was made it a little harder to get an exemption. My philosophy is it should be just as hard to get exempted from vaccinations as it is to get your kid vaccinated. And it should be just as expensive. That parents shouldn't be making the choice because it's the path of least resistance. So I actually like Ontario's approach to this. Because if you've got to watch hours of videos in person, that's just as onerous as having to take your kid in to get vaccinated. And I think there should be some parallel there. Michigan has used what I call an inconvenience strategy. So they also have sort of implemented something where parents have to go to the county health, get a county health education done, kind of similar to what Ontario is doing. They may have gotten the idea from Ontario since they're right across the border. And their waivers dropped from 5.2% to 3.3%, which is pretty substantial. I mean, that gets you, with measles in particular, that gets you from just outside of true herd immunity status to well inside of it. And so that alone can get added protection. So they did see differences there. Now, we're watching California closely because we don't think California, who eliminated their personal belief exemptions entirely a couple years back, we don't think their population is going to behave like Mississippi's and West Virginia's, where they just comply. And sure enough, that's exactly what we've seen. And the really unfortunate thing we've seen is a substantial jump in the number of kids who suddenly have medical exemptions. And what we've learned is there are medical providers who are just willing to sign them. These are not kids who have true medical exemptions. They didn't have them 3 years ago and they don't have them now, but they're finding somebody who will sign the form. And so you have physicians who are not acting professionally combined with families who will do anything they can to get an exemption, and this is the only way they can do it. And you've got, again, a pretty you've got a better vaccination rate in California than you did, but it's not as good as what people thought it would be. There's also so that's this replacement effect. When you eliminate a personal belief exemption, people will then try to get a religious exemption, and if you eliminate that, they'll then try to get a medical exemption. And with each step, you do see an improvement in vaccination rates, but there will be those families that are really strongly opposed are going to find another way, and they'll find somebody who will cooperate with them. Now, there are other good strategies out there. So Europe has used an approach where they fine people for being non-compliant. That is associated with increased vaccination rates. I don't think there's anything ethically inappropriate about that. But it's going to be totally dependent on the social structure of your society. And I know for a fact this would not fly in the United States. So we don't even talk about it or consider it because we know our population wouldn't tolerate it. Another approach is Australia's, which quite frankly, from a practical perspective, is identical. But it just looks different and smells different and feels different to people. And that is, they just give a tax, they basically pay people to get vaccinated. Now all you're doing there is taking tax money and paying people to get vaccinated. So the reality is you get a rebate on your taxes if you vaccinate your kid. That feels different psychologically. It's the same thing as if you fine people or increase the taxes on people who don't vaccinate their kids. But it works better, and they've also seen significant improvements in their vaccination rates. And you could argue that those strategies are more ethical than denying kids school entry. The one problem I have with school vaccine requirements is we're talking about children who have not made this decision for themselves, and denial of school entry is a big deal. And so I worry about that piece of the US approach, even though it's been an effective approach. All right, so the last thing is that we could do better with our communication strategies, and some of our speakers this morning have already spoken to particularly the way we can use public messaging effectively. One of the things we know is that a trusted healthcare provider is one of the best ways, at least in the United States, to get kids vaccinated, because they tend to be, even with the internet, for most families, the primary source of trusted information. And if they maintain a respectful environment and listen to families' concerns and respond to those carefully, we can frequently get families who are hesitant to vaccinate their kids. Now, Aristotle had something to teach us about this. Nobody reads Aristotle anymore, but he wrote a little book called Rhetoric, which was basically about how to persuade people. And this has been validated with data 2,000 years later, that what he said actually works. And he talked about character. The character of the person delivering the message has to be a good one. In other words, they have to be trusted. The audience, whether that's an individual in an office setting, whether that's somebody getting vaccinated in schools, then it's the school nurse, or whether it's the public health officer standing in front of the podium on TV, people have to trust that person. Logic, the message has to be factually correct and logical, but that's not enough. Because the really important piece is it has to resonate emotionally and elicit an emotional response in the audience. And that's what we don't do very well, because most of the people in public health and medicine and the health sciences are science-based. And so we like data, and we show people data. And data does nothing for the way people feel. Those numbers I showed you at the beginning of the talk probably didn't cause any of you to break into tears. But telling a story does. And stories are underutilized in what we do. The most powerful lesson, I think, and most people did not learn this lesson, but it's years back now when Larry King, one of our talk show hosts in the United States, had Jenny McCarthy on, and the American Academy of Pediatrics sent one of their talking heads. And it was a brutal massacre. Jenny McCarthy won hands down, even though everything she said was stupid. But you had this person from the AAP, probably wearing a white coat, who did nothing but talk about the data. And then you got Jenny McCarthy talking about her kid and what vaccines did to her kid. And it's not surprising the audience resonated with her. What we needed was a pediatrician telling stories about kids they'd taken care of who had been damaged by these diseases, and talking about their own decisions to vaccinate their children and why they made that decision. To make this personal, to make it emotional, into a vocal response from the audience. That's what we need to do in the public health setting, and do that more effectively. The other side is using fear. I'm not a big advocate for using fear-based tactics, but we can do that in a more subtle way. I mean, I think we should be taking advantage of those rare cases of vaccine-preventable disease that occur in our communities. When there is a child with Haemophilus influenza B and the media learns about it, we should be taking advantage to talk about the fact that this is a horrible disease. It used to be very common, and vaccines can totally prevent the damage that it does. So, as I mentioned earlier, we should seek first to understand, diagnose the resistance, and respond directly to that in a respectful way, in a way that finds common ground. And let's face it, we have common ground, because whether you're talking about public health or whether you're talking about the healthcare professions, we care about the kids, and so do the parents. And there's your common ground. And it's really important to emphasize that at the beginning, that this is about taking care of your kids. And this is how we need to do it. So that it's very clear that your starting point is the same goal the parents have. We need to be willing to compromise while educating. The goal is not to win, but to win people over. And so I think there is a point, particularly in that parent who really doesn't want to do all the vaccinations today, I think there is a point at which we have to be willing to say, okay, let's do these. I'll take what I can get, and let's have you come back in a couple weeks and we'll talk about the others. That, first of all, shows respect, which is a big deal in these relationships, because one of the things I see from some of the parents I see in the ER who don't want to hear anything is that they've been treated disrespectfully before by healthcare professionals, so they're totally unwilling to listen anymore. And so maintaining that trusting, respectful relationship is important. And then telling stories, using sort of that emotional resonance, I think, is a really important way to do messaging. And then, I don't think I need to tell you this, but we need to set a good example ourselves, and we should let people know we're doing this, right? I mean, I don't understand why every flu season we're trying to get people vaccinated. There's news reports on it. You never see a healthcare professional up there, whether it's the director of public health or a physician in the community or a nurse in the community, saying, I got my flu vaccine and here's why. That carries much more weight than flu kills 40,000 people in the United States every season, and we've had 125 pediatric deaths. If they don't know that you got vaccinated and you vaccinated your kids, you're starting behind. And so setting an example and making sure people know we're doing this, I think, is also an important piece of the puzzle. All right. Stay.